Hello, in this short video I'll be discussing the pathophysiology of aortic aneurysms and one common pharmacological intervention. To begin, let's first define what we mean by an aneurysm. An aneurysm, put simply, is any abnormal swelling or bulge in the vascular wall. This bulge is brought about by a weakening of the vascular wall which, when coupled with the continued force of pumping blood, can result in the balloon-like sacs seen in the figure to the right. This can happen at any point along the aorta, hence referred to as an aortic aneurysm. If the aneurysm occurs in the thoracic region or along the ascending aorta, it is called a thoracic aortic aneurysm. If the aneurysm occurs in the abdominal region or along the descending aorta, it is called an abdominal aortic aneurysm. The pathophysiology of an aortic aneurysm is all about the weakening of the vascular wall where the aneurysm occurs. There are typically four reasons why one's vascular wall may be weakened. These include poor matrix quality, an imbalance of matrix synthesis and degradation, a loss of smooth muscle cells or a change in smooth muscle cell synthesis, or trauma/injury. Poor matrix quality of the vascular wall is typically genetic. Conditions such as Marfan syndrome and Loeys-Dietz syndrome are connective tissue disorders and common risk factors for a thoracic aortic aneurysm. In these cases, a person may be born with a condition such as these, resulting in poor matrix quality and an increased risk of an aneurysm. In such a case, the pressure of passing blood puts stress on the already weakened wall, hence ballooning out in the aforementioned way. Trauma and injury simply refer to a mechanism whereby the vascular wall is weakened. This could include blunt trauma to the chest, chronic hypertension, or atherosclerosis, all of which damage the vascular wall. An imbalance of matrix synthesis and degradation is then linked to trauma, in that injury and trauma can bring about this mechanism. For example, in the case of atherosclerosis or infections like syphilis, inflammatory processes are activated as an initial phase of healing. What follows is an increased presence of degrading enzymes, which in turn can degrade the vascular wall matrix. This hence leads to that weaker vessel wall, leading to an aneurysm. And risk factors for this means of pathophysiology typically include those of atherosclerosis, such as smoking, age, diet, hypertension, obesity, and diabetes. Finally, a loss in number or synthesis of smooth muscle cells can also lead to a weakened vascular wall. Ischemia along the aorta can lead to a reduced nutrient supply to the smooth muscle cells in the medial layer of the vascular wall. This causes cystic medial degeneration, whereby smooth muscle cells in this layer are lost. In their place, amorphous ground substance is produced to replace this, hence weakening the cell wall. The common cause of a thoracic aortic aneurysm is hypertension, whereas the common cause of an abdominal aortic aneurysm is atherosclerosis. Both aneurysms are typically asymptomatic and found coincidentally. When the pressure inside an aneurysm exceeds the strength of the vascular wall, the aneurysm can rupture, causing internal bleeding which is life-threatening. In the case of this medical emergency, surgery is typically the only chance at recovery. Once an aortic aneurysm develops, the purpose of pharmacological intervention is to reduce the growth of the aneurysm to avoid this rupture. Although there is surgical intervention available to remove aneurysms, medicines on their own cannot do this. Thus, the purpose of pharmacological intervention is to take the pressure off the weakened vascular wall. A common way this is done is a drug called propranolol. Propranolol belongs to a class of drugs known as beta blockers and exerts its antagonistic effects by competitively blocking beta 1 and beta 2 receptors, which are typically induced by epinephrine and norepinephrine. These two messengers have a common therapeutic effect of stimulating increased heart rate and vasoconstriction, leading to an increased blood pressure. However, by blocking these effects, propranolol causes a decreased blood pressure, hence taking pressure off the vascular walls, which, in accordance with the pathophysiology of an aortic aneurysm, reduces the stress on the arterial wall, hence slowing the aneurysm's growth. As well as aortic aneurysms, other indications for propranolol include general hypertension, angina, atrial fibrillation, myocardial infarction, migraines, tremors, and hypertrophic subaortic stenosis. Nursing considerations for propranolol include patient education, monitoring for adverse effects, and contraindications. Whenever a patient receives any drug, it is important that they know exactly what they are taking and why they are taking it. Similarly, it is beneficial to begin educating a patient on independent use of a medication if it is long-term as soon as therapy commences. This should include dosages, timing, and relevant contraindications, such as hypotension in this case. As such, a nurse should provide this education to the patient. When a patient takes propranolol, a nurse must monitor for signs of adverse effects. This should include routine monitoring of a patient's heart rate, blood pressure, pulse, and respiratory rate to make sure the drug does not cause these to drop below their normal range. Similarly, the nurse should monitor the patient for signs of peripheral vasoconstriction, which is a common side effect. Signs of this include cold extremities, cyanosis, and muscle cramping. Finally, a nurse should be aware of any relevant contraindications in case they need to withhold the medication at any time. For example, beta blockers can mask the symptoms of hyperglycemia in diabetic patients and can aggravate underlying respiratory pathologies by constricting smooth muscle in the respiratory tract. As such, a nurse should be aware of such things to best avoid these adverse effects. Thank you very much for listening to this short video on the pathophysiology and treatment of aortic aneurysms. Here are my references.